this may be our best work in progress attendance about ever. So probably because we have Professor Hammer here, who has succeeded in doing something I've always wanted to do. He has his program named after him. It's the Hammer program. And he's not the lawyer on TV either, or on billboards. Have you seen that? The Hammer? Oh, yeah. Right around, sorry. And so HAMMER stands for Health Seeking and Multicultural Measurement Evaluation Research Lab, which is helping seeking what factors stop people from seeking professional health care when they need it, and culturally sensitive measurement. For example, how accurately do measures of health-seeking attitudes actually measure attitudes among individuals from rural Appalachia? And so Professor Hammer teaches counseling theories, techniques, and the practicum. He's a licensed psychologist in Kentucky and uses an integrative treatment approach that prioritizes mindful awareness of cognitive, emotional, interpersonal, and cultural process. And he is joined by Doug Spiker, second-year doctoral student in the counseling psychology program, who got his BA in psychology from Ball State, and then got an MA in clinical mental health counseling from Ball State after that, and has been working with children, adolescents, and families, involved with the development of child services and college students at Ball State, and then joined the Hammer Lab. So, I should have mentioned, since it's football season, Dr. Hammer's at Iowa State Cyclone.
For my PhD. I mean, I've been to so many different institutions, I can't keep track of it at this point.
Welcome and thank you.
Yeah. Okay. Well, thanks for having us, everybody. We're excited to be here and get to share some of what we're working on. We're going to be talking about mental health literacy, which is an extension of health literacy. Our objectives, we're going to situate what this thing called mental health literacy is and how it relates to health literacy, which maybe many of you are more familiar with, and there's much more research on health literacy compared to mental health literacy. We'll talk about some of the unique challenges that have started to show up in doing research in this area, and some of the constraints that we see that folks are trying to go with mental health literacy. They're trying to expand it into this much bigger construct, and there's some sticky things that are coming up as a result. And we're going to propose something different. We're going to propose starting to treat mental health literacy in terms of a theory rather than a single construct that is measured. And we'll talk about why we think that's a really useful and important thing to do. And we'll talk about implications and future directions based on that sea change that we're recommending. So
like Dr. Hammer mentioned, first what I'm going to talk a little bit about is how mental health literacy grew out of health literacy research. So when we're talking about health literacy, we're looking at two different branches in the health literacy field. The first one, and the most common one that's seen in the literature, is clinical health literacy. So this focuses on some core components of print literacy, essentially an ability to interpret health-related documents, oral literacy, an ability to effectively communicate with healthcare providers, and then last, numeracy. So one's ability to interpret quantitative information, for example, dosing on medication labels. The other branch of health literacy is looking specifically at public health literacy. So their approach is a little bit different than the clinical branch in that it looks at health literacy not so much as a risk factor, but a skill that can be developed. So a lot of the times what that's looking at is health literacy as an outcome, essentially to increase one's self-efficacy, to manage their own health-related outcomes, and also to feel more empowered in the healthcare environment. So before jumping into how mental health literacy and why mental health literacy grew out of the health literacy research, I first wanted to touch on what exactly is mental health literacy. So Jorm was the first to establish a definition of mental health literacy, and what he defined is this multi-dimensional construct. The first piece being recognition. So one's ability to identify symptoms related to mental illness. For example, like depression, whether that's anhedonia, sadness, feelings of worthlessness. So just one's ability to identify those symptoms. Also knowledge, which in itself is multi-dimensional, and it includes different facets of knowledge. So for example, knowledge of etiology, knowledge of self-care, awareness of professional help that might be available to you as well. And then the last piece is attitudes, and this very simply just focuses on attitudes that might facilitate recognition of mental illness or attitudes that facilitate appropriate help seeking. So Jorm argued for creating this construct of mental health literacy because he perceived mental health not getting as much attention in the public health domain. He felt that it didn't get enough of a spotlight and wasn't advocated for in increasing awareness around mental health issues and concerns. He also argued that health literacy itself didn't adequately address the knowledge and skills necessary to function effectively within the mental health care environment. And what's kind of grown, so essentially how mental health literacy grew out of the health literacy field is specifically that health promotion branch. So a lot of the time in the research when looking at mental health literacy, it's viewed as an outcome of knowledge interventions. Specifically, what some of you might have heard of is mental health first aid. So these are common trainings that are examined in the literature to see if both professionals and non-professionals experience any increased efficacy in working with individuals that might come to them with a mental health concern. But mental health literacy has also been examined on its ability to affect or impact different mental health outcomes as well. So for example, some of the research looks at high mental health literacy being associated with more positive intention to seek psychological help, or even more positive attitudes towards seeking psychological services. So as I mentioned, Jorm established the first definition of mental health literacy, but recently in the literature, some researchers are advocating for expanding the definition of mental health literacy to include additional constructs that they perceive as important for individuals as they operate within the mental health care environment. One of those being attitudes, so essentially one's evaluation, positive or negative, of performing certain behaviors, specifically attitudes towards seeking psychological help. The other one being stigma, so one's perceptions of someone who seeks psychological services, or even someone who has a mental illness, if they perceive that person as inadequate or lacking or weak in some way. The last construct that they've been advocating for including is help-seeking efficacy, which focuses specifically on the competencies and skills necessary to manage your own mental health concerns, but also to function effectively in the mental health care environment. A big concern with this, though, is that there's very little agreement on what constructs should be included or not included with mental health literacy. And what this has led to are several studies that claim to measure mental health literacy, but all of them measure very different constructs because there are very many measures of mental health literacy available. And this makes it really challenging to compare results across studies, especially when we're talking about mental health literacy interventions. And they're using different measures, so it's hard to say what intervention may or may not be most effective.
So, every scale developer knows that when you're trying to develop an instrument to measure a thing validly, you need to measure the entire construct, not just little parts of it. So if we want to try and make a measure of mental health literacy, we have to make sure that it measures all of those 5 dimensions that Doug showed you up on the screen with the table, and all of the subdimensions of all of those dimensions. And not only do we want to talk about mental health literacy related to a specific disorder, like schizophrenia, but we talk about mental health literacy as this overall thing, this overall knowledge. So that means that we need to be literate with regards to a wide range of mental health issues: depression, anxiety, schizophrenia, eating disorders, across these different dimensions. So if you're really going to measure general mental health literacy, a valid, reliable instrument has to measure all of those dimensions and all of their subdimensions across all of these different mental health concerns. And you can quickly see how unwieldy that becomes to create a measure that's many, many items to capture all of those things. And it's no wonder for this reason that all the mental health literacy instruments we've seen fall short of the mark. They measure certain parts of mental health literacy and not others, and what parts they do measure vary across studies, like Doug said. So we're comparing apples to oranges the whole time. It leads to a really disjointed body of literature. However, let's say for the sake of argument, it was feasible and possible to develop a mental health literacy instrument that measured all of these parts across all disorders. Let's imagine that. We would still run into at least two new problems if we did that. The first is that this is not very feasible. If you were going to measure each of these subcomponents reliably, say with at least 5 items per subdimension across all these subdimensions, you're starting to have an instrument that's 70 items, 100 items plus. Think about in the research you do, if you do survey research, if that sort of instrument is going to be feasible for your research study or for implementation in your clinical practice. It's probably not. You're going to have a hard time getting people to use that fancy instrument you just developed. The second thing is what we call construct proliferation. And this is where we coin a new construct. We develop a program of research around this new thing that we give a new name, but this thing already exists elsewhere under a different name. It's already been studied. And so when we develop something like looking at attitudes, stigma, help-seeking efficacy, these existing constructs, which already have well-established bodies of research. Doug and I work with these constructs in our research every day on studies that have nothing to do with mental health literacy. They're recognized by social scientists and medical scientists. When you take these existing constructs and you pack them in to this one big giant thing called mental health literacy, you start to create confusion among researchers. For example, we've seen studies where somebody says, I'm going to study the relationship between mental health literacy and attitudes towards seeking help, because I think if you're more literate, you're going to have more positive attitudes towards therapy. Reasonable premise, right? So here's how they implement it. They say, here's my measure of mental health literacy. And when you look at the items, they measure some knowledge components, like one of those dimensions, and then they measure some attitudes components, attitudes towards therapy and seeking help. And then they have their instrument that measures attitudes too. And then they look at a correlation between these two instruments and they say, look at the positive correlation between those two things. That's interesting. We can make theoretical meaning of that. But what's the problem? Is that we've correlated attitudes with itself. That's called a tautology. You can't conclude something when your mental health literacy instrument partially measures attitudes and your attitudes measure partially measures attitudes. It's misleading, because if you're going to say two things are related to each other, they need to be separate things. You want to have mental health literacy, which captures these things over here, and attitudes or stigma or help-seeking efficacy over here that are measuring separate things. You don't want them to measure each other, because what does it mean if we're looking at correlations amongst them? It gets really confusing. So we've started to see published studies in good journals that do just that. So it's pretty problematic. So what are we going to do about it, right? That's the question, because we're not the first people to mention this issue, by the way. Maybe not quite in this way, but folks are like, we want to expand mental health literacy to capture all these cool new things, but then it's really hard to measure it, and we're comparing apples to oranges. So what we're suggesting is that we stop looking at mental health literacy as a single construct that's multidimensional, as a single variable with a lot of dimensions. We want to move away from that. Instead, let's reframe it differently. Let's start talking about mental health literacy as a theory. Let's start talking about a theory of mental health literacy which has multiple constructs embedded within it. Well, I won't be clicking through those anymore. So we've got multiple constructs, and we can look at, say, the relationship between knowledge and how it influences attitudes and stigma, and how that influences outcomes, for example. So when we start looking at things, oh, did you fix it? Oh my goodness, he's so good. Okay. So when we start treating mental health literacy as a theory, we can conceptualize and we can measure each of these specific components much more easier. You can have a 5 to 10 item measure to measure knowledge of this thing, a 5 to 10 item measure to measure attitudes. It becomes possible to do good research because everything's really concise. And when you can measure things accurately, then you can create specific hypotheses about the relationships between these things. You don't run into that issue where you're correlating things with itself, which is something we want to avoid. And by treating mental health literacy as a theory, we can also honor the fact that these constructs like self-stigma of seeking help, attitudes towards therapy, these are things that already exist and have been studied in hundreds of studies. So we can honor that fact and we can more easily incorporate the new mental health literacy research we do into that existing literature. We can talk with each other across disciplines with this shared language, rather than creating this confusion and packing everything under this new name of mental health literacy and then not measuring it that well. Another cool thing about this is that we can start to move from piecemeal hypothesizing that we currently see in the literature towards theory building and refinement. So we can start to systematically say what variables should be a part of a theory of mental health literacy. What exactly are their relations and their causal ordering? What causes what, which influences what? We can start to talk about that in a sensible way. So these are a few of the things that we like about the idea of moving towards it as a theory. Other cool stuff we can do is we can start to pit a theory of mental health literacy versus other well-known theories like the theory of planned behavior, which we use a ton of in our research and is widely used by social scientists and medical sciences across the world. So we can start to ask questions like, does knowledge of depression symptoms, how important is that really? Does it account for unique variants in whether or not someone will go to their physician for medication or go see a therapist for mental health concerns? Do we really need to measure and account for that? Do we need to intervene with knowledge? Or are other parts of the model, other variables, actually that much more important? We don't have to pay as much attention to knowledge. We haven't really done the research to look at that directly. So we want to see what constructs actually prove their worth and are worth measuring and intervening around. In terms of practice, we can be much more intentional regarding what variables we're trying to target with our interventions. Because if we've got this big behemoth of a mental health literacy thing with these subdimensions and nobody really agrees, it becomes confusing about, okay, what is my program or my intervention trying to target out of these 18 things? How am I measuring the efficacy of my program? It becomes much easier to be specific about which piece in the theory we're trying to target.
So I am going to finish us off talking about where do we go from here, kind of considering the challenges that we've discussed and also considering the direction that Dr. Hammer and I are discussing is where does mental health literacy go if we're going to conceptualize it as a theory. The first challenge associated with this is how do we measure mental health knowledge? Because if you remember back to that table, knowledge itself is multifaceted. So do we include knowledge of etiology? Do we include knowledge of self-care, knowledge of services that are available? And not only that, when we're talking about mental illness itself, do we want to include knowledge of every single mental illness, right? So as you can see, it starts to just grow and grow and grow when we talk about how do we actually go about measuring this mental health knowledge component. Because this is really, I think, mental health literacy's unique contribution to the literature. As Dr. Hammer was touching on, you can find things like attitudes and stigma, and it has its own body of research. But this focus on knowledge specifically is unique to mental health literacy, and so figuring out how to go about measuring that is really important. And so one thing that we started asking ourselves and thinking about how to go about measuring this is what knowledge is most important for people to have around mental health? And even when you think about that question, it helps to narrow it down somewhat, but it's still a big question. And so we don't expect people to have the DSM-5 memorized. The typical layperson, that's not going to necessarily be helpful. So it's this focus on, okay, so then what knowledge aspects are going to significantly impact people's mental health outcomes? And so that's something that we're wrestling with and trying to figure out. I think another component of it too, as Dr. Hammer was mentioning, is that some measures of mental health literacy tend to confound knowledge with beliefs. And so going forward, how do we make sure when we're measuring this aspect of mental health literacy that we're discriminating between subjective beliefs and knowledge? And that in itself is a challenge too. Just the wording of the questions on a scale can lend themselves to being beliefs rather than knowledge. Unsurprisingly, considering the title of our presentation, the other direction that we're thinking about is how do we go about developing a model of mental health literacy if we're going to look at it as a theory? And again, this presents its own unique challenges because when you look at the literature, there's a lot of disagreement about what constructs should or should not be included. And so how to go about deciding which construct gets to stay and which construct gets booted presents its own challenges as well. And I think most importantly, because we were talking about how do you go about measuring mental health knowledge, where does mental health knowledge fit into a model of mental health literacy? Does it have a direct impact on mental health outcomes? For example, does it directly influence intentions to seek psychological treatment? Or is it mediated by other variables, like attitudes that we know have a direct impact on intentions to seek psychological help? Or does it not have a very significant influence at all? Because knowledge may be important, but we all know there's a lot of factors that go into whether or not someone seeks psychological help. So that's something else that we're thinking about too. And then also related to the health literacy research, we're asking ourselves, should we include what some might consider more of those foundational skills from that clinical branch of health literacy? The direction that the mental health literacy research is going now is operating under the assumption that people have these skills related to oral literacy or numeracy without really examining that. And so that's something else that we've been thinking about also is, do we include those? Because from the health literacy research, it's been found that lower health literacy is associated with poorer health outcomes. And so that's something that we've been thinking about as well in the lab. I know that through most of this presentation, we've been talking about all the challenges associated with this construct, but I think it's important to note too that mental health literacy has had a significant impact on building public awareness around mental health and mental health concerns. I think especially the mental health first aid training that's provided for individuals has been one benefit for advocating for the importance of mental health as it relates to other health-related concerns. So I think that's important to remember as well, is that even though there's challenges, that there's a lot of benefit to pursuing this research as well. But I just wanted to thank you for your time, for listening to our presentation, and we're looking forward to any comments or questions that you may have. So thank you. Click there. One more. Oh, that's right. You had the last one. Yeah. Plug.
So,
That was great. So I kind of wanted to ask, before I ask any questions, where you are in this process. Given some future direction, but I'm sure you've given it some thought, and maybe you've done something already, and maybe it's your dissertation, I don't know. So
Not right now, no. So one thing that we've already finished was writing a paper around this idea of mental health literacy as a theory, so more of a conceptual theoretical paper. Right now, what we've been talking quite a bit more about is the route of developing a model of mental health literacy, so looking in the literature and seeing what constructs are associated with these different knowledge components in the literature. So right now, we're definitely heading more of that theory building direction.
Yeah, and we're also thinking about instrument development because, again, one thing we keep coming back to is there's not a good instrument to operationalize mental health literacy. but we want to first kind of get on the same page with everybody about what, if we're going to treat it as a theory, and we're going to go to the historical heart of mental health literacy, which is that knowledge component. What exactly are the subdimensions of knowledge? We got to figure that out, and then we got to develop instrumentation to tap all those things. And skill development is a huge undertaking, so we're thinking about, do we want to put our resources into that? Because if you can't measure a thing well, it's hard to study how it relates to other things. It's kind of foundational. We just got done with a huge binge of skill development stuff, so we'd like to not have to do another skill development thing, but it might really be necessary. But we first have to make the case to our wider audience that it's worth moving away from this big, huge construct towards these multiple things that are part of a theory. Because we don't know if folks are going to be on board with that. We think we make a good case for it, but if folks aren't on board with that, it's just going to be us talking about this stuff. So that's why this conceptual paper is our first foray into this dialogue. We also, one thing, this is really kind of a thought experiment for you all, is related to that question that Doug asked. So ask yourself right now, if you had to write down 5 things that were the most important factual pieces of knowledge, those nuggets of wisdom that are important for you in maintaining your own mental health and well-being, what would those be? Does anybody have an idea off the top of your head?
I just want to take us a little backing up a little bit, just think back to the whole health literacy concept and it's how it's been tied to outcomes. So I think that's what people are really going to be wondering about. What is going to be the eventual? How does this variable impact subsequent outcomes, whether it's getting care or becoming more functional in their life, more happy with their life, that sort of thing.
Yeah.
And there has been research around patients' health literacy and that being associated with depression in particular. And I guess, and there's a lot of research that looked at knowledge versus health outcomes and finding there's not much correlation in healthcare. Unless it's tied to some specific skill or behavior. So as an example, there's clear data showing that patients who have poor health literacy are much less skilled at using their meter dose inhaler when they are treating their asthma or COPD or whatever.
Right.
And those people also have worse outcomes. So you can basically draw causality probably related to that. And that patients with lower health literacy tend to be less compliant with their medications. But there's some old RAND data that shows if you help those individuals navigate the health system, they can overcome that negative impact of the health literacy. And so that health literacy is more playing a role in acquisition capability. And if you looked at David Baker's theoretical model related to health literacy that was published in the Journal of Medicine.
Like functional
health literacy, yeah. And that's what we were originally taught by Joanne Nurse. We didn't come up with this. I mean, it was basically Joanne Nurse, who was a professor of education at Georgia State and nursingly developed kindergartens in Georgia, and then they propagated from there. She was the one who first taught us about this concept of functional health literacy being different than just literacy. But we also found out it wasn't so much health literacy, it was literacy. And that numeracy, those were 2 skills, and there was tight correlation between literacy and health literacy skills. And so I think what we developed with health literacy was, our tool was basically another measure of literacy, except we added numeracy into it and then found that that combination seemed to be associated with outcomes. We also found out we could drop the numeracy and didn't influence things that much, but there are other particular types of outcomes analysis that seem more related to numeracy. Probably got people on complex medication regimens. So that's why I'm kind of just curious to your thought process about utilizing that information versus targeting knowledge given what others have found. And patient knowledge, it doesn't necessarily predict outcomes as much as their capacity to get knowledge. And so is it more individuals' capacity to get mental health knowledge versus the actual mental health knowledge itself?
Mm-hmm.
So
Yeah.
before you go to Mark's question, actually, I think if you can help me understand, I understand, the mental health literacy is the sub-area in this overall health literacy. And so my question is regarding, I understand mental illness has its uniqueness. However, talking about the literacy, what makes mental health literacy distinguish from other type of disease literacy? For example, chronic condition literacy. And so help me understand that.
Yeah, we're sitting next to you, looking at the literature, asking those questions too, because my lab, we've done a lot of looking at what stops people from seeking therapy, and 5 or 7 years ago, I started seeing this thing called mental health literacy coming across the journals that I read, and so I was reading about it. I was like, okay, this is interesting stuff. And then at some point we're like, this keeps getting more and more popular, and we're seeing some interesting decisions that they're making. So let's figure this out some more. Let's figure if this needs our attention. And so we're asking the same questions. It's like, I don't know that it's been established that it's important, necessary to qualify it as a qualitatively separate form of literacy. Maybe we can treat it as another condition. Maybe we can use models of functional literacy. So these should all be on the table, and we've been spending a lot of time just laying it all out and being like, God, where do we start? So absolutely, that question, some folks may disagree, but that question is being asked right now and needs to be addressed. Absolutely.
And I think because when I saw your slides regarding the 3 dimensions, talking about the cognition, talking about knowledge, talking about the attitude, actually those highly tied to what Mark just mentioned, and about the capability and the functional, how the patient realize and know how to acquire the knowledge and the skill and translate it into their behavior change. And so in that way, they can either better align with their treatment, or they can have a better self-care, things like that. That's kind of my perception.
It's a piggyback onto all this. I think everything that I was thinking has been steadily coming out. But I wonder, going back to piggybacking off what Jenny said, maybe it's a health literacy thing overall. Maybe it's not necessarily, potentially not specific to mental health, but maybe other aspects of psychosocial factors are at play that may be unique to mental health, such as distress or self-efficacy, and those things that may be, better to try to measure within your population. Because the other thing is the other chronic diseases out there, like we look at diabetes and hypertension and things of that nature, they have scales of distress and self-efficacy and these other psychosocial factors that are specific to those diseases. Whereas when you look at mental health as an overall thing, you can't really look at it, like you said before, as an overall thing, because there are all these other conditions and illnesses that are at play. So maybe, I don't know, kind of understanding who's at greater need, or where maybe people with depression have more issues with self-efficacy, maybe people with schizophrenia have more issues with distress. So really trying to tease apart which psychosocial issues are at play, that then you can make this relationship with self-management. Because like Mark and Jim were alluding to, you have to have some sort of outcome. Like, it's nice to come up with a conceptual model or a theory, but how does that impact the patient population at the end of the day? And so I think really understanding all the different parts that are at play, more so from the personal perspective of the patient, will be really important to include in what you're trying to do.
Absolutely.
I think a quick, simple way to put this is, so you're going to develop the theory of mental health literacy. Well, shouldn't we develop the theory of physical health literacy?
That's an excellent Socratic question. Yeah. So a lot of what we see right now is we're problematizing the current state of research. So we're immigrants to mental health literacy, and we're, wow, this is interesting, trying to get a grasp of stuff, and we're seeing strengths, issues with you all are raising, and so we see 28 different tasks to be addressed, and we're thinking about what should we prioritize? What's the most important thing to start with? If we're going to try and join with mental health literacy researchers in upping our game, where's the most important place to start?
This may be heretical, but I sort of wonder if you could take the approach that this is an effort of salami slicing. And the example I'll give you is that if you look at the initial health literacy work and then the subsequent tidal wave, and there's actually, I think, been an article showing the dramatic, if you run Google or Medline, dramatic, it's logarithmic, like an area of publications. And what began to happen, and it still is happening, there were health literacy articles first on diabetes, hypertension, the big diseases. Then it went in health literacy measured in the clinic on rheumatologic disorders, and then health literacy in the clinic on fibromyalgia. And basically everybody just started doing it for their very specific disease process to figure out how they could carve out something for them. And I think there's been a movement as a step back of this being just a specific, valid variable in looking at healthcare delivery and for patients' personal health, the literacy concept, if you will, or health literacy. And so I wonder if you could maybe address this from that perspective, that mental health literacy is a pursuit of trying to find something that's not necessarily so important, but there needs to be mental issues addressed and skills related to that, and literacy is its own still separate thing. And there's nothing unique about mental health literacy per se.
Yeah. Mm-hmm. Yeah, it sounds like a reasonable possibility. Yeah, and we're aware too that thinking about how humans are and careers are made and the human side of research, and one of the things we've noticed about how mental health literacy is a thing that people study developed is that it seems, especially with Jorm kind of kicking it off, that there were things with health literacy that just didn't seem to fit for folks, and so there was like this big shift towards kind of treating it as its separate thing, where like the taxonomy used was kind of very much over here. It wasn't very integrated with the health literacy stuff, and we noticed that, and we thought that was interesting, and we wondered, should there be this gulf? Because the answer is probably not. I think because health literacy folks have had so much more time to hone their craft, that there's probably some really good things to learn and adapt, and let's not reinvent the wheel when we don't have to. So I think there's a lot of porting. Maybe we'll do some of that.
And it's an interesting kind of, when you look at the literature, as far as when Jorm first came up with this definition, this is more my own hypothesis, more than anything he actually said in the article, but it seemed like a reaction against basically like, hey, mental health doesn't get as much of a spotlight here, and mental health should get an equal spotlight. And it seemed like that's kind of where this branch of mental health literacy was born out of. And what's interesting is a lot of the recent research that's talking about expanding mental health literacy more is a lot of the times it's citing health literacy and saying we need to keep pace with health literacy. Like we need to follow what health literacy is doing, which is a bit confusing because then it feels like, well, why are they separate things then if we need to walk side by side with what they're doing? And so it does beg the question, how is this separate and how is this unique from health literacy? And so, yeah, you're all touching on definitely thoughts of that.
I just have a few suggestions. So, I guess starting from the beginning, have you had a student or have you done a systematic review to see how health literacy has been measured in mental health patients as a start? And then to look at, that would be a great start because then we can see where and how they're measured and what tools were used and what already exists, because if it already exists, then you have to then make a case of why you're either suggesting a change to it or you want to.
Absolutely.
And then I'm sure you've heard of the health literacy toolshed. It's comes out of Boston University, where they're the people who do the health literacy conference, annual conference. So it's the same. What's his name, Mark? Baker and Wolf.
No, Michael
Haas
Orlow
yeah.
is at Boston, and actually the other person I was recommending is Bill Talk with probably even better is Michael Wolf. Mike's at Northwestern, and he's done a lot of the really good health literacy research, particularly around prescription drug understanding, medication use, and the labeling and so forth.
But they have, so they've created this tool shed where they put every single health literacy tool up there, and there's over 250 of them. And since this is my area too, it gives me like highs when I think of how many tools are out there you can choose from. But I mean, one of your students could do a paper on looking at each of these tools to say which one really would be appropriate and has been used in a mental health population. So then that's your like start.
That's a great idea.
Yes.
I would posit that mental health literacy hasn't quote gotten the attention that he suggests simply because our society hasn't given mental health the attention it deserves.
Yeah.
I think compared to the other disease, there are more the public education and awareness part in this.
And the stigma, especially our stigma.
Yeah, our kind of day job is a lot of stigma related stuff. Yeah. What else? What else does this raise for you all?
There's already systematic review on mental health literacy measurement tools.
Yeah, there's a lot. There's a lot.
So,
Yeah, those are ones I think we've
Yeah.
and they have a grim tale to tell.
Yeah, and it's interesting too because there's measures, because you were kind of speaking to earlier that with the health literacy field, they were kind of carving out their own niche as it related to diabetes and other health related issues. And even some mental health literacy measures are specifically looking at certain mental illnesses. So for example, there's a depression literacy scale that only looks specifically at knowledge associated with depression. There's specifically one looking at schizophrenia. I think I've seen one related to ADHD as well. And so what's also problematic about these studies too is they say, well, we're measuring mental health literacy, and then they're measuring really depression literacy or schizophrenia literacy. And so there's a lot of measures and confusion about what exactly is being measured, just that varies from study to study. So, yeah.
Other final thoughts as we near the 50-minute mark?
I guess one question, do you think the act of measuring literacy reduces the stigma? Like, does that make sense? So the interaction between those things is maybe an area where mental health literacy is unique from other types of health, because the act of asking people about mental health and measuring it maybe makes it more of a common, normal thing that you would be asked about.
Yeah, it might. You might see a small bump from that if part of the problem is the silence around it and breaking the silence. I could see that. I've seen not in health literacy or stigma stuff, but I've seen other studies on how the active measurement changes the nature of the construct. So that's definitely a phenomenon generally we've seen in social psych.
What are your goals? What do you want to achieve in the next year?
Well, that's what we're here. We're thinking about what should our goals be, because I mean the overarching goal is we want to collectively join with other people who do mental health literacy and say how can we take the quality a notch up? How can we take the chaos down a notch? Because there's a lot of different labels for same things. There's a lot of poor measurement. There's a lot of stuff that if you don't fix this foundational stuff, you're wearing a ball and chain the rest of the way. So we're trying to prioritize and think about what is the biggest thing we need to tackle. So we haven't yet foreclosed on that.
Do you think it might, thinking about keeping mental health literacy separate from health literacy in general, is there any concern there about maintaining stigma by saying that mental health is somehow not on par with physical health?
Say more about the not on par.
So, I clinically with patients, I'll often say, right, if you had a broken leg, you could obviously go to a doctor, right? So I think there's, we as a culture have this urge to address health concerns, and certainly it's tried and true, right? There's lots of reasons why people don't seek health care, but there's obviously this big stigma against seeking mental health care. And so I'm wondering, by keeping them separate, is it somehow saying they're not equal and saying they shouldn't be equal?
Yeah, that's a good question. I wonder how researchers or patients would interpret that if they knew about them being separate or
My question is, could it be advantageous to keep mental health literacy as part of health literacy?
I don't see any detriment.
Yeah.
There's not.
I think
unintentional outcome.
it pains me when I start to look at a thing and then I find another body of literature that's already thought carefully and done a lot of work in that area. It's just there's so much recreation of the wheel, and so I think that's present here a lot. So I think more integration and crosstalk is almost always better. So I think we could do a lot better about mental health literacy folks taking advantage of the good stuff that's been done in health literacy so far.
So I have a question. So what does the literature say about currently the mental health literacy, questionnaires or surveys that are out there in health outcomes? Like, what are the trends right now? What does it look like? Is it similar to chronic disease, or is it?
So generally, from what I've seen in the literature related to mental health literacy outcomes, because the original definition was focusing specifically on knowledge and beliefs that impact or affect recognition, prevention, or management related to mental health issues. And so that's pretty, it coincides with health literacy and it fits. But a lot of the time in the literature, what they're looking at are intention to engage in certain behaviors. So something that I see quite a bit are attitudes towards psychological treatment, or at times they're even looking at mental health literacy as an intervention to decrease stigma that one might experience towards others with mental illness. So looking at knowledge interventions as a way to decrease stigma generally. So stigma is one outcome that I've seen quite a bit. Attitudes, whether that's towards treatment. And then also with mental health first aid, specifically with that, they're looking at whether or not people feel a certain amount of self-efficacy to intervene if someone presents with mental health concerns. So do mental health first aid interventions increase that self-efficacy or increase the intention to aid someone that might be experiencing a mental illness?
Okay, so right now the literature doesn't show how health literacy impacts self-management of those who've been diagnosed with a mental
Yeah, so everybody's really fond of cross-sectional surveys at one point in time, rather than looking at measuring this thing and then checking in about, did you do this behavior in the last 2 months? Like, did it lead to something? Or creating experimental studies where they give them the chance to demonstrate the behavior in question. So yeah, they're doing a lot of looking at psychosocial things with psychosocial things, and not as much tying it to concrete outcomes like doctor's visits, patient satisfaction, improved mental health. That's a step short of that, and why that's the case. Have ideas about.
And we did the mini mental status exam very explicitly until I started charging for it. That's one of the things. But has there been research around patients' health literacy relative to how they respond? The PHQ-9. And there's good tests now to pick up depression in the clinical setting. Pretty good tests to pick up anxiety in the clinical setting. And how are these influenced by patients' health literacy? That to me would be a ripe area for research that's not already been done, versus trying to establish mental health literacy separate, so that literacy or health literacy is a component, has been a variable influencing these mental health illness detections, and also patient interpretation of them and their skills and so forth. And that's where I'm struggling with this whole thing. Like it was brought before, we don't have congestive heart failure health literacy, hypertension health literacy. We have how patients with high blood pressure manage their illness, what are their outcomes based on their health literacy skills. To me, it's the same thing. If you have anxiety, that's a clinical, real disease, and how you manage that, how you seek care, get your medicines would be influenced by this attribute of health literacy, and there isn't a separate mental health literacy. Maybe I could then push the pendulum back. Because it was fascinating to find that there's an entire systematic review about mental health literacy measurement, and maybe just stop and write an article on the absurdity of this. That might get you.
There's been an article where they've addressed essentially the point that you're all bringing up is mental health itself should not be separate from health literacy. And then of course Jordan responded and said, no, it needs to be its own thing. But yeah,
because that's his thing.
Yeah, no, absolutely. Yeah.
And that's, I think you could add to that chorus of this and be fascinating.
Yeah, we're figuring out where we stand.
But this is why I might want to talk to Michael. I mean, this is all he does. He's a PhD. He's totally been immersed in this for years. And he has done some of the best cutting edge. He's on all the review committees that work on a lot of the original health literacy grant funding mechanisms and so forth. And he's a good guy. I mean, you can just email him and talk. Cool.
He still has funding to do that annual conference at Boston.
So that's Michael.
That's Michael Power,
yeah. It's getting close to running out because it's art.
I
think and Michael's been more practical, like you said, he's been collecting things. What research has he done? He's written opinion pieces.
Yeah, but he hasn't.
Yeah, and he hasn't.
And that's because he primarily, this is like his hobby, but he's like a family practice physician. I think is his passion. And whereas Michael Wolf is a health literacy researcher, he knows this inside out.
Great idea.
To talk with you.
All right. Well, I'll loiter for a bit if you want to talk with me or Doug afterwards, but thank you so much for your time.
Thank you.